started, there was only the two buildings, so this building that I'm in presently, Reef, and the Rainforest building. And at that time, definitely is not as many program services as we run now. And we were under the two executive officers, and the services were split between primary health care, but of a medical sense, a clinical sense, and social emotional well-being. And presently our model is now more integrated, with social emotional well-being being definitely a major role in that patient journey through that clinical model. So do a lot of the staff that are here are health professionals with many years of experience. So that also guides us with supporting and mentoring the health workers through their journey and their career and where they need to go. Some health workers certainly do have a passion for particular things. No longer. We did a lot of ours through TAFE as well as another RTO. But a lot of it was online, and then they just they would do a lot of peer support with each other and mentoring through that. They have a lot of because the allied health here as well, so they can go to them as well for support throughout their training as well. We have a diabetes educator, the dietitian, so they do a lot of support with the health workers as well. Wuchopperen currently on our database we have just over 10,000 current clients. Of that, approximately probably over 6,000 is very regular clients. Majority of our clients has chronic disease as everywhere else. Those clients, the integration model that Wuchopperen has approached to take on chronic disease is incorporating all the areas working together in a case management process in helping those clients to manage and monitor their chronic disease. So our focus is a lot on the chronic disease, but also we have then the other two areas, which is men and male youth and women's, child and maternal, where their program services are more towards the preventative side. So doing that preventative health in having play groups and doing group sessions and one-on-one education, where those services provide more of that intensive focus on helping the mum, the bub, the young male. So, but I would say that a majority of our clients are chronic disease focused. But we do the exercise physiologist does women's groups, so exercise groups, and we're trying to focus more on that preventative health focus and not focusing more on the end, coming back to the beginning and having that pathway to prevent everything before they get to that period of going on to dialysis and so forth. We currently have 12 health workers.
And health practitioners?
Not at present. They are. They have completed their studies as health practitioners. We're currently going into this year. Our EBA is up for. So a part of that process will be putting in that health practitioner into that EBA and going from there. But my diploma at the time, because I've gone from health worker to program manager to then health manager and then to the role that I'm currently at. So I was manager women's, child and maternal, and now I've jumped over to manager shared services. So and I think what also Wuchopperen has also, I know over the years that I've been here, is also introduced health workers to research. We're an organisation that is always sourced to be a part of a lot of research that occurs up here in the far north. As I was a health worker all through those years, that also was a pathway and also helped me on my journey, was that research, being a research fellow on many, I've done about 5 research projects, and the biggest was over 4 years with Kanini, and it really helped my journey as a health worker.
Of course.
Yeah,
that's good.
I see the health worker role as the cultural connection for our people between medical health and who we are as in our identity of who we are. We, as a lot of the community, their traditional way of healing is been lost for some people, and when they move away from their communities and they come and live in an urban setting, they then even more have to go to a medical centre to then source that help. And the health worker is a very important role to be that person that helps them to understand the changes and what they need medically to then heal and move forward with the changes that are occurring in their life with chronic disease. I think if that role wasn't there, we wouldn't be so successful with closing the gap. I think in terms of clinical care, in clinical practice, it's played a vital role, not just in a health organisation, but they're in hospitals, they're in now in private practice. So that role has become, it's from where I was as a health worker, it's now like everywhere, which never was before. So it certainly has, it's got there slowly, but it's now a role that certainly will be playing its part in the future.